Fixing health care was one of Premier Rob Canu's hallmark promises during the election campaign. But almost halfway through his mandate, it appears hospital wait times in Winnipeg are not trending in the right direction. New numbers from the Winnipeg Regional Health Authority show they're at times higher now than when the NDP took office. With more, CTV's Jeff Keele joins us now live. Jeff, what is the province saying about these numbers?
Manitoba's health minister says they have added hundreds of doctors and nurses, but they know more needs to be done. They're committed to it, but says this will take time. The nurses union says the time for action is now. Rebecca James and Pavel White are sleep deprived.
I'm pretty tired. I haven't slept. We haven't slept.
That's because they say they just spent 20 hours waiting in the St. Boniface Emergency Department as James was battling a blood infection.
Oh my God, exhausting and staying on a chair. I really hated it. And yeah, they're just really awful.
They're not the only ones waiting. The latest numbers from the Winnipeg Regional Health Authority show the median wait time in Winnipeg in December 2023 was 4 hours, an annual high. In February, a peak for the year so far of 3.97 hours. The times dipped down, only to go back up to 3.65 hours in July. All of these numbers are higher than August 2023, which was 3.23 hours 2 months before the NDP took office.
What we're hearing from both our nurses and from the public, wait times are increasing in our ERs and urgent care. So, yeah, we're definitely not going in the right direction.
Premier Rob Canu and the NDP government promised to fix health care during the election campaign 2 years ago. Manitoba's health minister says since taking office, they've added more hospital beds, 900 net new nurses, 200 doctors and hundreds of other healthcare workers, as well as primary and minor injury clinics. Plus, they say more initiatives and hires are on the way.
But what we need is a long-term sustainable trend in the right direction, a meaningful change. That does take time, but we're going to continue doing the work so Manitobans see that happen.
The minister says other provinces are facing similar challenges, calling this a complex problem that will take time to mend.
The reality is we're dealing with the consequences of years of massive closures and cuts to emergency rooms.
I think that the time for playing the blame game and blaming the previous government has to stop.
The numbers from the Winnipeg Regional Health Authority already showed that the median wait times for all hospitals in Winnipeg went up from 3.42 in July 2024 to that 3.65 number in July of this year.
So, Jeff, what plans can we expect from the province to cut wait times?
Yeah, the health minister says that they are looking at improvements to health links to make sure, people are going to where they should go to maybe keep those emergency rooms from being clogged up. There's pledges to have more doctors in emergency rooms. And remember, there's another one of those big campaign promises that the premier made, and that's to reopen the emergency room at the Victoria Hospital.